president marked his 1 year in office, celebrating notable achievements. Some of them included infrastructural projects. There has been a lot of analysis, a lot of commendations, a lot of concerns raised from different stakeholders. In this video, I'll critically analyze two of the president's key policies: healthcare reform and the student loan policy. I'll give my take on these two policies, look at some of the advantages and some of the challenges. This is Discourse, and I'm Azobike. The President's Healthcare Infrastructure Policy. This particular policy focuses on 4 key areas: infrastructural development, pharmaceutical production, that's local pharmaceutical production, healthcare workforce development, and health insurance coverage. Now, for infrastructural development, the President has initiated, or the government has initiated, 10 major projects across the country, in places like Kaduna, in places like Asaba. They've sought to develop diagnostic centers and some specialist centers. Remember that healthcare is on the concurrent list, meaning that both federal, state, and local governments will develop the healthcare system concurrently. Now, what the federal government aims to do here is to complement what the states do, complement what the local governments will do as well in terms of development. So they are focused on things like diagnostic centers, things like specialist centers will help to fill in those little gaps that you find when you have your primary health center, your secondary health center. It's designed in a way to complement what the state and local governments are doing. For local pharmaceutical production, the federal government is partnering with companies to ensure that as much as we can, we manufacture what we need for our healthcare system locally. The healthcare system for Nigeria is one of our critical elements of national security. If your healthcare system has to rely on importation, it's a very precarious situation. The government is initiating projects that will ensure that most of our productions are done here in Nigeria. There's this test kit manufacturing plant in Lagos that the government recently initiated. So in terms of healthcare workforce development, what the government is trying to do is to ensure that we train more healthcare professionals. First of all, to fill the gap that is being left by a lot of our healthcare professionals who have decided to migrate, who have decided to go to seek greener pastures elsewhere. This has left our hospital wards really lacking doctors, lacking all sorts of healthcare professionals. So the president thought it wise to increase the quota, increase the slot for healthcare workers training within our education system quite significantly, so that we'll be able to train more doctors, more nurses, more healthcare professionals. In terms of healthcare coverage, the government is seeking to increase coverage from about 17 million Nigerians to at least 50 million Nigerians to ensure that we can access healthcare, that we can have access to affordable healthcare cover. The more Nigerians that can get affordable healthcare cover, the better for every one of us. So the government at some point aims for universal coverage, but being able to cover 50 million Nigerians with government-backed health insurance would be a very good start point. Now, some of these policies that I just mentioned, you might not have started to feel the impact right now, but if at least you know that these things are coming on stream, hopefully in a few years, you will begin to feel the impact. You will begin to see these projects. You will begin to see more of these graduates as well. And I won't fail to mention the fact that we should also focus more on retention of our workforce. If you train these people and you allow them to get into a health system that is not ready to accommodate them, that is not ready to meet their needs, of course, they will want to seek greener pasture elsewhere. Healthcare all over the world is very lucrative. Nigerian workers have distinguished themselves as people that are very skilled and disciplined. Now, they are a hot location for foreign recruiters. The federal government will have to go beyond just recruiting more people or training more people to making our healthcare facilities more comfortable for our citizens, so that we can work here, so that our healthcare professionals can choose to work in Nigeria. The Students Loan Scheme. The president signed the Access to Higher Education Law 2024, establishing NEL Fund, an organization that manages loan for students in tertiary institutions institutions across the country. Initially, they designed that project to cover students in only government-owned universities and colleges of education and polytechnics, only government-owned institutions. But then they revised it, went back and revised it, and now it also covers Nigerian citizens who live here in Nigeria who attend private universities. So what university that you want to attend would depend on your ability to gain admission. If you have the requisite academic background, money will no longer be an issue for you. That's what it means. So you will not be restricted to only public institutions just because you want to benefit from the student loan scheme. I like that part where you can choose to go to a high-flying private institution in Nigeria, get the training that you need, you get the loan, and then you pay back. A benefit of that scheme is that it's interest-free. What you pay when you get it is what you pay back for however long it takes you to repay. But what are the challenges? In my view, it has a few challenges. One of them is who is eligible for the student loan? How well funded will NEL fund be? Those two questions are interlinked. The reason is simple. You can only give out based on what you have. If you promise and say every eligible Nigerian citizen will have a right to student loans, you can say that. Can you implement it? How much is it going to be worth? We're talking a country of 200 million people. We're talking a country of a massive population of young people seeking university education year on year. So if you say every Nigerian candidate is eligible for this loan, and don't forget, when you do that, your amount that you need to fund this loan will change from session to session. The number of students that passed JAM this year will be different from the number of students that will pass JAM the next year. And then when that happens, how will it affect your budget? So if NEL fund will have a fixed budget, which I think they will, how are they going to fund these varying numbers of students or intakes for each session? Also, they've just mentioned that NEL fund will cover private and government. The disparity in terms of the fees for private and government, how is that going to be looked at? In most cases, the way student loan schemes are structured, they have fixed amounts that they give to each student. Is it going to be a situation where you have a different fixed amount for government schools and different fixed amount for private schools? Because the disparity in their fees is very, very large. You can't give a loan of 2 million to somebody whose school fees is 5 million or 10 million because you're giving 2 million to the other person whose school fees is 500,000. Now that's the disparity I'm talking about. Nigerian universities that are privately owned charge as much as 5 million, 10 million, while government universities charge 250,000 to maybe 500,000. Now, if you want to give somebody a loan, two students that belong to these different categories, how are you going to do it? Is NEL fund going to treat them differently, or is NEL fund going to disburse a specific amount? So if you disburse a specific amount, which is closer to the 500,000 than it is than to the 10 million, can we really say that we are covering private universities as well? So that's an issue that we are looking at how that is going to evolve. Also, what you have mentioned is the eligibility criteria for this loan. Is it just if you pass JAM, you are eligible? Does it have consideration for your background, your financial background? Is it designed to assist the children of the poor? Because if it is going to be limited by resources, limited resources will lead to specific number of slots per session. I think that's going to be more likely than not. So when that happens, who is going to be prioritized in this scheme? Is it going to be the children of the wealthy or the children of the poor? How are you going to determine who is wealthy and who is not? Do we have systems in place to determine the needs of these particular students, to be able to profile them and say, this is your family income, you are not eligible to have this student loan. Oh, this is your family income, you are eligible to have this student loan. And if you do that, are you not then going against the law that says that every indigent Nigerian is qualified? Now, this is how it was conceived. This is how it was signed. You will then have legal issues where the child of a Nigerian billionaire wants, or the child of a Nigerian millionaire wants this loan because he or she has the right to seek for the loan, has also the connections to get the loan. And then if Nelfund decides to say, no, let's use this loan to support children of very poor people, children from very poor backgrounds, children from very poor families, what do you think the children from not very poor families are going to do? You are taking that benefit from them unlawfully, because the law that you sign says that they have the right to benefit from the scheme as well. The scheme does not segregate rich from poor. That sounds like it's something good, but in terms of the implementation, it might not be. Also, in terms of the repayment, inflation is going to keep driving prices upwards. When people get these loans, we don't know how long it's going to take for them to repay. Does government have enough resources to continue putting in? Because take for example, when you put in the first payments, you are not going to get this money back in another 10 to 15 to 20 years before they even, or just say in another 10 years before they start paying. Let's assume that these students will finish and get a job, right? So they finish and they get a job. Do we have a cutoff amount, a minimum amount that they will earn before they are expected to start to repay? In an economy where getting a job is a hassle, it's not like everybody will just graduate and get jobs immediately and then we'll start paying the loan. You see, a lot depends on our economy. How are they going to start paying loans unless they have jobs? These are issues that are quite critical, that down the line we'll begin to see them. At this conception stage, some of these issues might not be apparent, but as we begin to go deeper and deeper into the scheme, as government commits fund into this scheme, as students commit their own future into this scheme, our hope is that it's going to be sustainable. We don't want a situation where somebody gets into the first year of school, benefits from this scheme, and then you're not locked into the scheme. In the third year of school, they tell you, but it wasn't funded. Or maybe there's a change in government, this particular government is not bothered about education and all that and all that. And even though we have a legal requirement or we have a legal entitlement for funding, we didn't get any fund. So people can be in school, people can be on the loan scheme and still get frustrated because their fees might not be paid. These are some of the issues. So I've mentioned some of the benefits and I've mentioned some of the challenges, and these are real world, real life challenges I'm talking about.